COVID-19 in Illinois. To start, I'd like to turn it over to our IDPH Director, Dr. Ngozi Ezike, for today's medical update.
Thank you, Governor, and good afternoon, everyone. The number of cases statewide is generally trending upward, and positivity rates have increased throughout the state. Of course, more in some counties and regions than others. Many people may be thinking that the numbers aren't that bad, that we look better than many other states. They're better than what they were a few months ago, and that is true. They're not as high as they were in April and May, but they are increasing. And if we don't take further steps to reduce the spread of the virus, our numbers will continue to go up, and we will be right back where we were just a few months ago. Anyone who thinks that wearing a mask or keeping their distance doesn't help, you are just wrong. Both of those incredibly simple actions have been shown to slow the spread of the virus and decrease the number of cases. Let me just share one specific example. This was recently released in an article in a journal, and it was talking about two hairstylists that had COVID-19 that were on the job before they knew they were positive. They found out they were positive, so in contact tracing and trying to identify all the people that they exposed, there were 139 clients who these two hairstylists had interacted with while they were symptomatic or pre-symptomatic. But as it would be, the company's policy and the community's policy was that indoors people wear face coverings. And as a result, after testing and looking at all the people that were exposed, there were no secondary cases reported from clients that had been exposed to those hairstylists. And just in case you think that maybe they weren't really positive, but the stylist did happen to infect their spouse and their child and their child's partner. So I think this is great evidence that, in fact, these mitigation measures work, and I'm hoping that people will continue the uptake of face coverings as we proceed. Today, we are reporting that 1,759 people were newly diagnosed with COVID-19 for a total of 186,471 cases. Since yesterday, most regrettably, 30 additional individuals were reported to have lost their battle with COVID for a total of 7,573 lives lost. As of last night, 1,552 individuals were in the hospital, hospitalized with COVID. Of those, 368 individuals were in the intensive care unit, and 129 individuals were on ventilators. In the last 24 hours, 46,668 lab results have been reported for a total of 2,896,063 tests performed statewide since the beginning of this pandemic. Yes, we still need more testing, and yes, we have been working to increase the number of tests every single week. We also need more contact tracing, and we're working with local health departments to hire those people. But we also need more personal responsibility, more community responsibility. Events like the White Trash Bash, where hundreds of people gathered, are ways that the virus can spread if we're not masking and distancing. It can be the cause for increase of cases, and someone who's at the event could spread it to someone else, who could spread it to someone else, and so on. It doesn't matter what the type of event is. It could be big events in the community, sports tournaments, large gatherings for protests, family reunions. No one should be gathering in large groups where you can't keep 6 feet of distance and can't wear a mask. And this is not about trying to take away people's freedom. It's about stopping the spread of a deadly virus. COVID-19 is an invisible threat with very visible consequences. You're tired of hearing it. I'm tired of talking about it. Believe me, I want this over as much as everyone else. But this virus is not tired. In fact, it's trying to gain momentum. It's cunning and it's elusive. Some infected people have no symptoms at all, or very mild symptoms. I keep hearing from my contact tracers at the local health departments that they're hearing the same story over and over. I had no idea that I was positive. The symptoms I had, I thought were allergy symptoms. I never would have thought it was COVID. So please don't overlook those allergy-like symptoms. COVID can look like so many things. And please, I know we love our family, but just because it's family, don't think that it's necessarily okay to get together without masking and distancing. If your family members are not in your immediate household and they're not in your established bubble, please understand that you are exposing yourself and them to the additional risk of virus spread. We do have too many unfortunate examples also from the contact tracing of extended family gatherings turning into dozens of positive cases. Unfortunately, people even gathering for funerals and then going on to catch COVID in multiple people at that solemn event. I understand that there are things that can't be delayed or put off, but please use the mitigation strategies available to put ourselves in the best possible situation. I also really want to focus on respecting others, especially those who are going out of their way to respect you. Especially, I want to highlight those who are working in restaurants. The wait staff all has to wear face coverings. When wait staff come to your table, put your face covering on as well. They are wearing their face covering to protect the patrons. And patrons, we should do the same and give them the same courtesy. Let's do what's right and protect ourselves and protect others. Let's wear our masks and let's keep our distance and keep washing our hands. Thank you so much. Gracias, Gobernador Pritzker, y buenas tardes a todos. El número de casos en todo el estado está subiendo en las últimas semanas, especialmente en algunos condados y regiones del estado. Muchas personas pueden estar pensando que los números no son tan malos, no son lo que eran un par de meses pasados, y tienen razón. No están al nivel que estaba en abril o mayo, pero están creciendo. Pero si no tomamos más medidas ahora para reducir la propagación del virus, nuestros números van a crecer más y vamos a regresar a donde estábamos hace un par de meses. Si piensa que usar un cubrecara o mantener su distancia no ayuda, está equivocado. Se ha demostrado que estas acciones simples reducen la propagación del virus y bajará el número de casos. Hoy informamos 759 personas recién diagnosticadas con COVID-19, para un total de más de 186,000 casos. Desde ayer se reporta 30 personas con COVID-19 han muerto por un total de más de 7,500 vidas perdidas. Desde anoche, 1,152 personas en Illinois estaban en el hospital con COVID-19. De ellos, 368 pacientes estaban en la unidad de cuidados intensivos y 129 pacientes estaban en ventiladores. En las últimas 24 horas, más de 46,000 pruebas de COVID-19 fueron hechas. Si necesitamos más pruebas Si necesitamos más pruebas y estamos trabajando para aumentar el número de pruebas cada semana. También necesitamos más rastreo de contactos y estamos trabajando con los departamentos de salud locales para contratar más trabajadores. Pero también necesitamos más responsabilidad personal y más responsabilidad comunitaria. Eventos como fiestas y graduaciones donde muchas personas se juntan son exactamente cómo se propaga el virus y porque estamos viendo un aumento de casos. No importa qué tipo de evento sea. Podrían ser grandes eventos en la comunidad, torneos deportivos, protestas o reuniones familiares. Nadie debe juntarse en grupos fuera de su familia donde no pueden mantener 6 pies de distancia y no usen cubrecaras. No estamos tratando de quitar la libertad de las personas. Se trata de detener la propagación de un virus mortal. COVID-19 es un enemigo invisible con consecuencias muy visibles. Estás cansado de escucharlo y yo estoy cansada de decirlo, pero el virus no está cansado. Está vivo y bien. Desafortunadamente, este virus no parece que se va a ir en cualquier momento. Si sales a comer a un restaurante, ponte su cubrecara cada vez que el servidor llegue a tu mesa. Haz lo correcto. Protégete y protege a los demás. Use su cubrecara, lávese sus manos y mantenga su distancia. El poder está en sus manos. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you. Thank you very much, Doctor. Dr. Ezike and I are joined today by Marco Morales, the Benefit Payment Control Manager at the Illinois Department of Employment Security, to provide an update on the nationwide unemployment fraud scheme investigation that we announced earlier this month. The state unemployment systems across the country continue to work at a feverish pace to manage through a surge of benefit needs related to this pandemic. A level of impact so severe that tens of thousands of Americans are still struggling to access assistance, even as state systems like IDES process an unprecedented number of claims. A poorly designed federal pandemic unemployment assistance program compounded those difficulties by opening the door for a nationwide fraud scandal, as I announced 2 weeks ago. Today, in a continued effort to provide the public all the facts as I have them, we want to offer a three-part update. 1, why is this fraud happening? 2, what is Illinois doing about it? And 3, how can the public protect their financial security? So let me begin by explaining that the Federal Pandemic Unemployment Assistance Program, or PUA, was passed by Congress in the spring and provides benefits to independent contractors and 1099 workers. This is a brand new program that the federal government rushed to develop and then left each state to create its own separate system. As a result, there were massive holes for illegal fraudsters to steal federal dollars from taxpayers across the country. Since the pandemic began, the U.S. Department of Labor's Office of Inspector General has seen a dramatic increase in the amount of unemployment insurance fraud. Historically, investigations made up 10% of that agency's workload. Today, it's 55%. This includes investigative matters in all 50 states. Because this scheme is nationwide, the number one thing that we've been asked to do here in Illinois is to fully cooperate with federal investigators who have a broader jurisdiction and greater resources than any one state or any local investigative force. Additionally, the Illinois Department of Employment Security is working extensively to provide all necessary information to the Illinois Attorney General, local police, and all engaged prosecutorial forces. On that note, I want to recognize the Attorney General and the entire office that he leads for their tireless work to protect the people of Illinois during this pandemic. In addition to working with law enforcement, IDES is also taking every action to track down and cut off fraudulent claims, reviewing flagged files to identify commonalities and patterns. The highly experienced money launderers who have perpetrated these crimes use the same payment methods that regular filers do. For that reason, IDES can't simply cut off common dispersal mechanisms that also serve as lifelines for innocent users. IDES has identified over 120,000 counts of fraud, 107,000 in the PUA system since its launch in May, and about 14,500 in the standard system since the beginning of March. As a point of reference, IDES has processed more than 2 million claims in 2020. That's nearly 8 times the 271,000 claims that were processed last year. The number of fraudulent claims pales in comparison to the number of Illinoisans in genuine need of assistance. So let's not allow the conversation around unemployment to imply otherwise. I want to ask members of the media to help spread the word that an individual who has not filed an unemployment claim but has received a debit card or an unemployment insurance letter in the mail has likely been a target of this fraud. If that's you, here's what you need to do. Go to the IDES website, that's at ides.illinois.gov. Click on the link that says Report Fraud and Identity Theft, and fill out the contact form located there. You do not need to call the agency if you don't hear back immediately. IDES will get back to you in the order of submission, and in the meantime, there's a link on the IDES fraud reporting page to get your own free credit report. Reporting a case of potential fraud isn't just about helping out the federal and state government. It's about ensuring your own personal financial security. Importantly, individuals who have self-reported and have been properly flagged that they've been a victim of fraud won't have a 1099 form sent to the IRS on their behalf. Otherwise, there will be an additional set of hoops to jump through in a few months' time. Despite the fact that this is a national program that was poorly designed and susceptible to fraud, I can promise Illinoisans that our state government and our state law enforcement authorities will do everything in our power to support anyone who's been affected by this nationwide failure. Before I hand it over to our next speaker on this PUA fraud topic, actually before I take questions, I want to build on the updates that Dr. Ezike provided on COVID-19. Let me begin with some good news today. As of today, Illinois is performing an average of 41,000 tests per day over the last 7 days. And I want to thank our testing team led by Derek Lindblom, without whom this milestone could not have been reached. Unfortunately, the virus rages on. 2 weeks ago, 10 of our 11 Restore Illinois regions had 7-day rolling positivity rates below 5%. That's 10 of 11 at below 5% 2 weeks ago. By last week, that had dropped to only 5 regions below 5%. As of yesterday's data update, we now have just 4 regions with a positivity rate below 5%. I'll remind everyone that the health metrics that will send a region back to tougher mitigations are these. If a region sees 3 consecutive days of a positivity rate averaging 8% or more, or if a region experiences 7 out of 10 days of increasing positivity, plus a sustained 7-day increase in hospital admissions. IDPH and I continue to call on local officials to pay close attention to the data for their communities and, where necessary, step up and impose greater mitigations on a targeted basis to bring down the number of infections and the positivity rate. Otherwise, it will only be a matter of time before the state of Illinois will be forced to step in on a regional basis and impose resurgence mitigations like closing bars, indoor dining, and more to reduce the spread of the virus. Without local action, even more stringent regulations restricting public interaction, or in the extreme, another stay-at-home order, might be in your future. We've seen positive examples of responsible action at the local level across the state. Mayors in Chicago and in Springfield have taken sustained proactive actions to emphasize safety. Local health departments in Kankakee and Peoria are stepping up public awareness efforts. The Carbondale City Council unanimously imposed fines to enforce the state's mask mandate. Sangamon County is rolling out fines and permit suspensions for rogue restaurants and bars. Cook County has issued new capacity guidelines for indoor gatherings, fitness facilities, bars, and restaurants. But these interventions are much more effective when paired with collective action among our state's residents. Our goals to save lives and keep people from getting sick far outweigh any personal inconvenience. This is about the people and places that we love. And we need all our residents to take this seriously and to protect ourselves and each other. Statewide, we're seeing 2 new infection trends that are different than a few months ago. First, the largest increases in cases are occurring among young people, especially between ages 20 and 29. And second, the percentage of the population contracting COVID-19 outside of the Chicago region has dramatically increased. This does not in any way suggest that those are the only two categories of people who are in danger. This virus continues to ravage people of all ages and across the entire state. But young people and those in downstate Illinois are no longer the smallest part among those who are newly infected. Let's be clear, this virus is dangerous, no matter how young you are, because of the long-term damage that it can cause. It's not just a matter of how likely am I to die. Young people who survive COVID-19 report fatigue, breathing problems, and heart issues. What's more, even if your COVID experience seems mild or asymptomatic, you can still spread it to others who are more vulnerable and may end up hospitalized or worse. We all want answers, and we all want certainty. But the frustrating thing about a brand new virus is that doctors simply don't know the extent of its long-term effects because it's only been around for less than a year. They're working on understanding it better and developing therapies and vaccines. But until then, let's do the things that we can control and that will keep you safe. So let me remind everyone, wearing a mask in public places is required. Keep some physical distance and don't indulge others who ignore public health guidance. These are the best things that you can do to keep you and your family and your friends healthy and to keep our economy moving forward. We're all safer and stronger when we're all in Illinois. Thank you, and I'd be happy to take questions from members of the press.
I have a question.
Hi.
Good afternoon.
Good afternoon.
Wasn't the point of the lockdowns and school closures to flatten the curve and reduce hospitalizations?
That was certainly one point of it. Again, the point in the end is to reduce the number of people who get sick and the number of people who die. So all of those things are obviously related to one another. Hospitalizations, people who go into ICU, people who go on ventilators, and then people who die. We're trying to reduce all of those numbers. Yeah.
Right, and then today Mayor Lightfoot said that things won't get back to normal in schools until there's a vaccine and everyone takes one. Is there going to be some state mandate to take a vaccine in order to get our kids back in school?
No, I can't imagine that. What I do think is that once a vaccine is available, I think many, many people will want to get vaccinated. We obviously want to get to herd immunity. We have, for example, with measles vaccine, just to give you an idea, about, I think, 95% coverage in the state of Illinois, people actually getting the measles vaccine, or at least above 90. I actually think we're at 98. Now that I recall, we were at 98% the last time I looked, about 6-8 months ago. And so herd immunity is something you only really can get with vaccines. And so we want people to get vaccinated if it's an effective vaccine, and we'll make it available to everyone, especially to those who are vulnerable.
Our goal here, I mean, we can't eradicate COVID.
No, nobody's been able to eradicate the flu or any other. Yep. You can't eradicate it entirely. That's absolutely true. But remember, this is not like any other thing that we've faced in our lifetimes. 155,000 people or so have died in the United States in about a 4-month period. Just to compare, the flu takes about 30 to 50,000 lives per year. So take the 155,000, multiply by 3, that's roughly the death count that could occur, and then look at that in comparison to the flu. We have a vaccine for the flu. We don't have one yet for COVID-19.
Sir, to follow on Amy's question, when did the goal change as you've been shepherding us through this? When did the goal change from flattening the curve to mitigating all the effects of it in terms of COVID, in terms of hospitalization?
The goal has always been to keep the people of Illinois healthy and safe. That's always been the goal. We talk about flattening the curve because the very first thing we didn't want to have happen was for hospitals to get overrun, because then people are going to die. If you can't get into the hospital because every bed is filled, and we've seen that, by the way, happening in some other states where they literally, in some communities, reach capacity and there is not a hospital bed available. What you know is that if you fill all